So just as a reminder, audience, so this is your human cell, okay? Your cell is not this big, okay? It's super microscopic. In fact, I can tell you that because I've been looking at it under microscopes. This is just to demonstrate to you that every day we have, these 37 trillion cells in our human body, different cells for different organs, but inside each and every one of those cells, there's very similar things. The nucleus, the mitochondria. The mitochondria make energy from the air you breathe and the food you eat, right? So when our mitochondria produce this energy, this ATP, the energy currency of every cell in your body is running on that. So under travel stress, two things are happening. First, oxidative load, right? You've got altitude, higher altitude. You've got that radiation that I mentioned. You have that sleep that you mentioned, right? So all of those combined are going to produce reactive oxygen species.
Have you made it past menopause, or are you going through it now? I'm Dr. Pat McShane, and on the Women's Health Span Voices podcast, I'll guide you through the menopausal transition and beyond, helping you to thrive in this powerful time of your woman. Hello and welcome. I'm Dr. Pat McShane, and this is Women's Health Span Voices. And I have a very important voice we're going to be working with today, Dr. Monisha Bhanote. Dr. Bhanote has multiple certifications in different kinds of medicine, primarily pathology and then integrative medicine and culinary medicine as well. Probably she'll weave a little bit of that information into our talk today. And we're going to focus on travel primarily, I think, in our interview, because that's been her special interest or one of her special interests. And in fact, she is an author as well, The Anatomy of Well-Being, and the founder of Wellkula Institute and Travella Wellness, which is the travel piece in there, I think. So I'll let her tell us a little bit more about how she decided to get into the area of travel, because for our senior women audience, a lot of us have now a little bit more time and freedom and maybe a little bit more money to do some travel. And so we're going to be encountering travel issues, travel medical or physical issues. So how did you get interested in that? And tell us a little bit more about your focus now.
Okay, so thank you so much, Pat, for having me on your podcast. I'm excited about having this conversation and speaking to your community about something that probably isn't top of mind as a health concern, but when they hear it, they're never going to forget it now. So for me, I've been traveling since the age of 18. Once I was out of the house at high school, actually 17. I did not come back home. I'm basically like a nomad. Every 7 years, I'm moving somewhere. I've lived on multiple continents. I'm always somewhere traveling. I think that travel brings you a bigger world perspective and you get to learn about other people's culture and everything like that. But one of the things that I've noticed is after spending decades looking at human cells under the microscope as a formally trained pathologist, and when I say lots of cells under the microscope, like literally millions of cells that I've seen diseased, and understanding that there's a deeper mechanism behind it. And we know that lifestyle is a big contributor to these mechanisms. But one of the gaps that I was seeing in that education and that experience was that my patients who are, aged like 35 to 75, they were coming back from their trips and they were like, "Hey, Dr. B, I got this. My immunity went down. I got sick." Or when I was on my trip, I got stuck in the hotel room. My digestive tract was off. Or I just couldn't keep up with the rest of the family. They went out and did all these excursions, and I just felt like so tired. Right. And I'm going, well, there's physiologic pathways there that we aren't focused on, and they become actually more apparent when we're on the move. And this could just be a weekend away, right? This doesn't need to be like, oh, you're flying transatlantic. It could just literally be a weekend away and you come back exhausted, or you go and you're not feeling it. And
One or 2 hour time difference for me. Already I'm struggling a little bit. So I hear you.
there you go, right? And so, like I said, I've been traveling since I'm 18, and for a very long time, quite a few decades. And people are always asking me, how come you're like getting somewhere and you're fine? Like you don't need a nap or you don't need to do this, and you're not taking 2 days to recover. And then when you come back, so I'll get to my secrets in a minute. But really, what I want you to understand is that travel is already exposing the problems happening in your cell, right? They're the ones that have been quietly happening over decades in five key cellular systems that I focus on. So, from digestion to immunity to energy to focus and circadian recovery, they are already under pressure as we age. Okay. And it's just the travel experience might bring them to light, right? Like you might be like noticing them, but underneath the mechanism has always been happening. And we know that as we age, because I know your podcast is all about women's health span, right? So, what's going on
Right.
in women's health as we're aging? In general, you got to know that our microbiome as we age is less diverse. So the microbiome that we had at age 25 is not the microbiome we have in our 50s or 60s or 70s. Okay. The mitochondria, the little organelles inside our cells that produce
Oh,
energy for each and every one of our cells, is producing less energy, less ATP per cycle. The immune system is running a little hotter, right? So, not as precisely as it maybe did when we were younger. Our circadian clock is less anchored. So, then when you go for your weekend away, or maybe I have a lot of patients that love cruising, right? And I'm like, okay, well, you're not even really changing time zones when based in Florida, right? You're not really changing time zones. You're getting on a cruise ship and it's taking you, you're pretty much in the Caribbean, but yet they still feel it, right? So there's things
maybe
happening
it's
that,
eating maybe it's eating dinner at 8 o'clock and drinking 3 glasses of wine.
oh, so much of
that
that, so much of
that
that,
could
right?
have something to do with it. Yes.
But we have to think about, like, on that cellular level, our body is encountering something that we haven't considered, right? So if you're flying, even if it's a short flight, you are getting more cosmic radiation than if you were on the ground, right? So
Right.
that when you're getting that cosmic radiation, what's that going to do? That's going to generate free radicals. And that's going to affect your antioxidant systems even more. So if you don't have the ingredients to fight off these free radicals, you're going to experience some cellular fatigue, let's call it, right? When we're on the go, I don't know, Pat, what kind of traveler you are, but one of the things I like to, like people like to sit outside cafes and just watch people. If you ever
Yes.
watch people in airports, it's like watching ants on sugar, right? Because everybody's cortisol is just through the roof, right? And it's like this disruption in, like, from the cortisol rising. And then, as you already mentioned, meal timing, right? So we might be eating. Maybe we've got an 8 o'clock dinner time on our cruise ship, or maybe we're out doing excursions all day and now we're eating at 10 o'clock at night. So now your gut bacteria, which have their own chronologic clock, microbiota chronometer, right? The clock in there, that gets disrupted. And so basically modern life is putting a lot of stress on our body. And this lands a lot harder for women in midlife, all right? Because the systems that were buffering us earlier, right? So our estrogen is no longer there, right? So now we can't support that mitochondrial biogenesis. Our gut microbiome diversity, as I mentioned, is not where it was unless we are very intentional about eating our 30 different plants a week, right? Our
Right.
immune regulation is no more the same protection. So, all of this is basically saying that travel just reveals the gap between your cellular resilience that you had at 25, 35, and the cellular resilience you have now. And so, that's the conversation we're going to have today. So, travel is not the problem. Don't get mad at travel. Okay. Travel is just the stress test that is revealing what's going on with your cells underneath and how fragile they are.
I did a podcast recently about circadian rhythm, and it seems like it's a major issue whether we stay put in one place or not. Again, modern lifestyle, 24/7 lights, maybe LED lights, etc. Meal times that don't sync very well with our intrinsic natural biology, lack of activity in many instances. So we've got circadian problems before we ever get on that plane or that ship, certainly. And aging does certainly exacerbate that. So tell us a little bit more about the physiology and about some of the tricks. I want to hear about the tricks to work around it. Yeah.
Yeah, yeah. There's so many tricks, right? So, we can take them from the pathway of the five mechanisms, right? So, if we think about one of the mechanisms, your energy, right? So, why are you feeling so exhausted, either on the trip or when you get back from the trip? And it's not really necessarily just tiredness. We think, oh, I'm tired. I took a trip. This is like normal. Actually, it's cellular energy failure. Okay. So remember, I mentioned those mitochondria, right? So those little
Mhm.
organelles inside your cells, right? I always pull this out for my patients to see. I love it when my patients can have a conversation with me and they're like, Dr. B, my mitochondria. And I'm like, we're talking now. Like, this is how
We
my patients are now. Like, they learn.
Mitochondria show up quite often in my podcasts as well with lots of our speakers. So
Yes.
hopefully my audience will have at least some idea of mitochondria.
Yes. So just as a reminder, audience, so this is your human cell, okay? Your cell is not this big, okay? It's super microscopic. In fact, I can tell you that because I've been looking at it under microscopes. This is just to demonstrate to you that every day we have, these 37 trillion cells in our human body, different cells for different organs, but inside each and every one of those cells there's very similar things. The nucleus, the mitochondria, the mitochondria make energy from the air you breathe and the food you eat, right? So when our mitochondria produces energy, this ATP, the energy currency of every cell in your body is running on that. So under travel stress, two things are happening. First, oxidative load, right? You've got altitude, higher altitude. You've got that radiation that I mentioned. You have that sleep that you mentioned, right? So all of those combined are going to produce reactive oxygen species. If you haven't heard that word before, okay, imagine this. Here's your cell. Every day we are getting exposed to oxidative stress. Okay. Our cells, when they have the right ingredients, those being antioxidants such as vitamin A, C, E, alpha lipoic acid, glutathione, all these ingredients, and plant based antioxidants, it can fight these off, right? But when we don't have them, it doesn't fight it off. It creates those reactive oxygen species, which is another terminology for it is free radicals, right? So you can imagine these free radicals like to go to the rest of the body and cause more cellular damage. It's an aging process. It's a natural process that's going to happen, right? And so when you have that, the body doesn't like it, right? It's affected. So you need to support it. The other thing is when we have that sustained cortisol, this is why you need to learn how to be like a non-stress traveler, like I'm all about the packing before, making sure I got my snacks, not, grabbing sugar at the airport, all that kind of stuff. That elevated cortisol will prevent your mitochondrial biogenesis, right? So making more energy, making new healthy mitochondria and replacing the ones that have aged out. One of the things that we see in the aging process is mitochondrial dysfunction. We do not want dysfunctional mitochondria. We want our mitochondria to work so we have energy, right? So all of this is happening. So there are some key ingredients. So some of these ingredients that individuals might know is things like CoQ10, right? So what is CoQ10 going to do? It's a cofactor inside the mitochondrial electron transport chain that helps produce ATP. Another ingredient that I like is PQQ that signals to your mitochondria to make more. Adaptogens. I know some people know about like ashwagandha, for example, as an adaptogen, but I like shishandra, right? So these are a few ingredients, but You got to remember the lifestyle part of it without addressing, all right, I should not be eating the bad airport food. I should be preparing my snacks when I go, right? I should not be eating the salty food, the 3 glasses of wine because they're free on the airplane. No, that's going to disrupt all of that, right? The other thing is caffeine. And I think, we're very quick. If we have an early flight, we'll grab a cup of coffee there's a literally a Starbucks everywhere, right? And
Right.
so what the caffeine is doing, it's telling your cells to ignore the fatigue signal, right? So now your mitochondria aren't actually getting the raw material that they need. It's basically, you can kind of consider in a way caffeine as a band-aid on to what is actually happening under the cellular process. So we want to support the cellular process of what as we age. And why I'm so focused on the cellular process is because, like I said, I've been looking at cells under the microscope. I've been diagnosing, everything from gastritis to reflux to prostate cancer to breast cancer, you name it, I've diagnosed, right? And at the end of the day, the simplest way for me to describe that is your cells are angry. When we get diseased cells that aren't functioning, they're angry because they don't have the ingredients to make them function.
Yeah, the body is basically set up to heal, essentially, and maintain health. And we can disrupt that process. And some external things will impact it as well, as you've been speaking about. But basically, if we set the stage for healing, that process often does a very nice job by itself.
Yeah. And then one of the other pathways you had already mentioned was circadian, right? So that circadian clock that's already disrupted before we even go anywhere. It's probably one of the most underappreciated regulatory systems in the human body. Right. So, and it really matters for our aging audience. It actually matters to every audience, depending on, from your childhood growth, all of that, right? The circadian clock is itself synchronized by external cues. Right. So those cues are light cues. So one of the tricks, and it's honestly, it's not really a trick. It's to me, it's just basically common sense because I do travel a lot internationally, and those going from East Coast to transatlantic is usually an overnight flight. What do people do when, they might sleep on the plane and then they get to their hotel and then they sleep again, right? The first thing you actually want to do when you're getting off a plane is drop off your luggage and go for a walk, an hour-long walk. Reset that circadian rhythm because that light exposure is going to tell your body's clock, hey, it's still light here. Your
Mhm.
gut microbiome will take 3 days to catch up. Okay, but your 24-hour circadian clock for your light wake sleep cycle, that can be done in that day, right? If you don't want to do the walk, that's fine. Get on one of those hop on, hop off open air buses, and still like go around and tour around. This is really important because when that coordinated pathway falls out of sync and that cortisol is happening, it's also creating an inflammatory cascade. So we don't think about travel creating inflammation in this way. We know that when we eat something bad, we're creating inflammation, right? But just the physical act of doing this also creates inflammation. So we want to make sure we're supporting that. Adaptogens is a great way to do it. Whatever adaptogen you want to take. I like holy basil. I think holy basil is great. I don't know. Have you ever used that, Pat?
No, I
Oh,
haven't heard of it actually.
oh, you haven't heard of it? Oh boy.
No.
Okay, yeah. No, holy basil is really good because it works on the HPA axis, right? So our axis that's already stressed out, our cortisol system, and it kind of helps recalibrate without stimulant effects. So you can actually grow this plant. My mom grows this plant in her garden, and you can throw it in a salad if you want.
Huh.
That's the beauty of botanicals and plants is you can eat a lot of them. One of my favorite adaptogens is holy basil. And holy basil is a plant that you can actually grow like in the garden and you can throw it into salads and stuff. My mom grows it in her garden. But what's beautiful about it, it is an Ayurvedic plant that works on the HPA axis, so your stress system, your cortisol system. And what it does is it supports kind of recalibrating that stress response without stimulants. Because what I see often is people are using a lot of stimulants, whether that might be the caffeine, whether that might be sugar, whether that might be melatonin to help you sleep, right? So there's all these things that are being used that kind of aren't the best choices in the long run on this, this cellular level. One of the other ingredients that I really like for circadian rhythm is magnesium. Our most of our bodies don't have enough magnesium to run all the cellular processes that they need, and so magnesium can help influence that sleep architecture that gets disrupted. So both holy basil and magnesium work beautifully without sleep aids, right? So if like I said, you don't need to use these when you're traveling. This is just what's happening physiologically in the body. I think the other one, so like I said, I have 5 processes that I go through: digestion, immunity, focus, energy, and recovery. We talk a little bit about recovery, we talk a little bit about energy. But gut health, your digestion is one of the first things that you will experience. In fact, it's if my neighbor is listening to me, I'm sorry, but she messaged me and she texted me. She's like, "Hey, Dr. B, what can I do? Because I was out in California and it's only a 3-hour time difference, and I haven't had a bowel movement in a week after traveling." And I'm like, "Well, that certainly isn't good." And she's like, "Do you have your Travella?" And I'm like, "Yeah, I do." But so when people are thinking of the gut, they're thinking of the gut just as a digestive organ. But we know that the gut is a command center for everything, right? From producing our neurotransmitters like serotonin to our influencing our immune system to really setting the tone for hormonal metabolism inside our body, right? So it's not just processing food, it is a significant portion of your biology. And I mentioned earlier that your microbiome loses diversity as you age. So when you lose that diversity, and for those who don't aren't familiar with what your microbiome is, it's basically the gazillion, and I know that's not a very technical term, but there's a lot of them. There's more microbiota organisms in your body than human cells. So what happens is that those change as we age. Okay, they're not as diverse. Certain ones grow that are potentially more inflammatory, and the ones that are protective are not so present anymore. When those bacteria change, your gut lining becomes more permeable. Okay. When it's more permeable, that means basically anything entering, any byproducts can go into the bloodstream, cross that GI tract into the bloodstream and trigger chronic low grade inflammation. So if you think about what chronic low grade inflammation does, it can affect every tissue in the body, from the brain to the joints to the cardiovascular system to the skin. So it's a term we kind of talk about, inflammaging, right? So it's that
Right.
chronic inflammatory background noise that's driving aging. And everyone feels it different. Like some people will be like, "Oh, I went for a walk and now my knees are hurting." Some people might be like, "Gosh, I'm like waking up with these weird rashes all over the body." Like it's going to show up for everybody differently. So I don't think we can put people in a bucket and be like, "Okay, here's the solution." You really need to personalize this when it comes to your healthcare. But my point in sharing this is that the gut being the origin of both disease and health for every problem you're experiencing, right? So whether that is cardiovascular disease, whether that is mental health, whether that is autoimmunity, whether that is cancer, all of that comes back to this inflammatory pathway. And that gets more emphasized. So if you're not a good traveler, if you come back and you're wiped out, that's a sign that there's other stuff going on in your body. So don't ignore it and just be like, "Oh, I just traveled. Now I need to just rest." No, that is a communication because our cells are constantly communicating. that, hey, my body needs something. Let me figure out what it needs before I develop more disease.
And you actually have founded a company and instigated a nutraceutical that can be used for some of this. So maybe tell us a little bit more about who might use that and when in the travel process you would institute that.
Yeah, absolutely. Thank you, Pat, for asking. So, after doing this for decades, looking at human cells under the microscope, diagnosing disease, doing testing on individuals to see what are the gaps in where they need more support, I didn't want to add more noise to the market. There's plenty of supplements on the market for people to take. What I wanted to make sure is that we were formulating and creating something that did not exist in order to fill the gaps that I see that the people need support with. And so what I formulated is the first physician formulated nutraceutical that combines 5,000-year-old ancient wisdom science from botanical herbs with our modern longevity science ingredients that we know now can repair the body, right? So it's the first one that's kind of combining all this, and it works on such a beautiful level. I'll tell you what some of the ingredients are, but let me share with you how I really got into this. Was about 5 years, well, maybe now it's 6 years ago. During the pandemic, we all remember the pandemic. Okay, it was good for some of us, it was bad for some of us. Honestly, I loved it up to a point. Okay, I loved it because the operating room was closed. I didn't have to go in and diagnose disease after disease and just spit out hundreds of thousands of cancers, diagnoses, so I was like, this is great. There was nothing we could really do. So I was just taking walks every day, like 4 or 5 miles a day, listening to podcasts and audiobooks. And I'm like, okay, this is wonderful. I don't have to be in the hospital at 7 a.m. for the first surgery. I loved it. So instead I'd go for a walk. But on one of these walk, towards the end of 2020, and I take the same route every day. And one of those walks, something happened. I was taking a walk, and I felt something kind of hit me in my head right here. And the only thing I had on me was my cell phone and earpods and a hat, right? And I didn't know what it was, and I felt this, like, it almost felt like a airplane fell on my head. It was actually quite quite painful. And
Oh,
so, I take off my hat, I put my hand to my brain, and I'm like, "Oh my god, am I feeling my brain? Like, what is this?" As a person who's held organs in their hand, I'm like, "Oh my god, what is this? Am I feeling brain here?" And so I look down at my hand, and from here down all the way, my shoulder, neck, all covered in blood. And I'm going, okay, I don't know what's happened. So I call 911. I mean, what else do you do? I called 911, and I'm just standing there waiting for the ambulance to come get me. And while I'm waiting for the ambulance, this guy comes up to me and he goes, "Did I just hit you with my golf ball?" And I'm like, I don't know, because where is the golf ball? And I'm not on a golf course. I'm in a residential neighborhood. So this guy was about 200 yards back behind a house and hit a driver shot going 150 miles an hour outside of the golf course. And it hit me in my left temporoparietal region.
wow.
Now, if anybody has ever fell off a bike, fell off a horse, had a car accident, whiplash, any kind of fall, the brain has very little space to move within the skull. Okay. So, what happens when the brain can't like do anything? There's a major inflammatory cascade that happens. And I got to experience that firsthand. Okay. So, where you go from being 100% healthy, no health conditions, to now having autoimmunity, gastric disruption, hormone disruption, circadian disruption, to, let's see, memory loss, focus loss, ear ringing, you name it. I was like, I don't know what's happening here. Basically, everything. It's an entire syndrome of symptoms that I was experiencing, and so much so that I couldn't write or type or talk. I was missing words. I was dropping stuff. I go to boil water for the tea kettle and I burned so many pots of boiling water because like I'd forget it's there and like there'd just be like a scorched pot, a lot. Plus the chronic fatigue that comes from that. So my 4 or 5 mile walks turned into literally walking to the mailbox and back because I was so fatigued. And so when I went to all this, and here's the kicker, it hit me so hard that it also caused 3 cervical disc herniations. So now I had
Wow.
chronic pain on top of that. All from
Wow.
one little, like, what is it? Like a 3-inch ball, right?
Mhm.
Totally blindsided. And so went to all the specialists and the specialists are like, "Okay, we have this option for you. We can give you ADHD meds, we can give you Alzheimer's meds, we can give you Parkinson's meds, all the stuff to bring my memory like somewhere." The surgeon's like, "Well, we can do an anterior discectomy." And of course, being that I've spent so much time in an operating room, I know, I'm not going to have somebody pull out 3 cervical discs and then have my thyroid disrupted and risk, when you know too much, you know too much, right? So I'm like, well, that's not going to happen. Right. So now I'm in this process of how do I repair my body as naturally as possible because I don't tolerate medication side effects and all that, and I don't want to be on chronic pain meds for the rest of my life, and I don't want, I don't want to be on this. So I had to really pull from my integrative medicine training, where we went deep into Ayurvedic medicine and botanicals and herbs and supplementation and really pull into that and go, all right. What is it that ancient wisdom and modern science is really saying about how do I get get rid of my chronic fatigue? How do I make more mitochondria? Because you know what the ER doctor said to me? He goes, after I actually told him how to suture me back up because I didn't want like suture material in my skull. Like I made him do it with my own hair strands and then like with a mirror and stuff. It was a real like as if you're watching Doogie Howser. Like I'm like, all right, let's do this. But he told me, he goes, "Go sleep it off." That's what he said to me. And I'm like going, "Wait a minute, I need to make brain-derived neurotrophic factor, right?" So that happens when you move your body. I'm not gonna go sleep it off. I have to figure out how to move my body. So part of that really came from, besides the physical therapy and stuff, but supplementation. So at one point, I was on 30 different supplements to try and repair my body and get to a place that I was before. And from that, I found really powerful ingredients. Okay. And this is where the Travella story really comes in. Those ingredients that I was taking in there, like Bacopa manieri and gotu kola and the holy basil that I mentioned to you, and things like PQQ and glutathione, all these things to kind of wake up my cells from this situation that I found myself in, that I didn't want to take those 30 bottles anymore. And I wanted to get back to traveling the world, something that I was doing, like multiple times a year and not having a problem with. I had to figure out how to get back to that. And so a couple years back, I was traveling to Southeast Asia and my father, who's 75 years old, came with me and I'm like, "Dad, you can't get sick. You have to be on the same protocol as me." Okay. So, because we're going far, we were going to like, 5, 6, 7 countries. We had a lot of plane rides. We were gone for a month and stuff. So I put him on the same herbs that I was on. I mean, my dad was at the top of, Batu, like way up, like he was walking those 20,000 steps faster than I was. But he was taking the herbs and the botanicals that I was taking, and so after spending, quite a bit of time researching and developing the formulation, we have developed what I call Travella Essentials. It's here it is. Travella Essentials in a 3 capsules a day formulation. So I basically went from taking 30 different supplements to now this formulation plus an omega and a vitamin D. Like, I mean, it's a big difference when you like are like, okay, my body's working. The cells are repairing itself. I am not fatigued. I mean, not only do you get physical fatigue, you get mental fatigue, right? So I was experiencing all of this from just a Saturday morning walk, right? And ironically, the audiobook I was listening to that day is called Limitless, which is a book about the brain from Jim Quick. And I'm like, gosh, talk about irony, right? And so with that, we finally brought it to the world because when I started talking to my patients in the last few years about this, and we were talking about their disruptions in their health and what they really wanted out of life, and they wanted to be able to enjoy going on trips and doing this. And mind you, I do retreats. So I've spent a lot of time with my patients in person. We like going to international locations, and I can see like, all right, when they're fatigued and when they're not. And really seeing this, I'm like, this is what I need to share. Not just to put another supplement out there, but what is missing in the world that will actually help people. And that's where we're at. Like I'm just super excited about it because I hope it will really help a lot of people.
So you're recommending this to women who have traditionally or historically experienced fatigue and all the symptoms that you mentioned
I
earlier
I
while
basically
traveling.
recommend it to both men and women, okay?
Hmm.
So, anybody who is experiencing any health concern around digestion, immunity, brain fog, focus, energy production, recovery, like they're just not recovering anymore, it's meant to work on pathways. It's not meant to work on a disease, okay? Like it's working on those 5 physiologic pathways that I know our cells get disrupted because we're living on a different planet nowadays. We're not living from like 100 years
Yeah,
ago. We have more exposure to our cells than ever. So for me, this formulation is, all right, how can I support my cells in that gap between just living? Right? That
right.
existence of just like it's an everyday daily wellness supplement. So it's not just when you travel. Depending on how many time zones you go, we do have different protocols for that, but it's filling the gap of something that I think, I talk to my patients, I'm like, Nobody wants to go in the garden except my mom, I guess, to grow different herbs and plants and put them in their salads and stuff. We're so busy. We need something that's going to fill that gap. And that's what I created.
And earlier we mentioned symptom chasing, and this is kind of the opposite of symptom chasing. So you're trying to support the cells rather than go after, fatigue or diarrhea or whatever it is that a person might be experiencing. So so
And
that
that's where my expertise is. I've been looking at people's cells forever and seeing how angry they are, right? And I'm like, your cells need support. And let's start supporting them. And I tried to make it as easy as possible.
Well, good. That sounds like a great thing. What other advice or messages that you would like to give our menopausal audience about travel or just maintaining your energy level and your health in general? We've
Yeah,
covered a lot of territory, but maybe I skipped over something. Yeah.
I think, because in my experience, what I have found that a lot of healing happens through the gut. I think that looking at that broader sense of the gut, not just as a digestive organ, but the gut to be the key to heal any of your chronic issues and both prevent them as well, right? Is key. And, how you approach that, like personally, how I approach that with my patients is I do in depth diagnostic testing, really looking at the status of their microbiome because no, not everybody needs to be on a probiotic. Not everybody needs a digestive enzyme. Always start with the foundation of food as medicine. And, I'm trained in culinary medicine, right? So, how do we take our food, eat the rainbow, eat the 30 different plants a week? How do we take that microbiome that has been deteriorating since the age of 25 and replenish it in a way that's going to support us?
Yes. Yes. And avoidance of ultra-processed foods, avoidance of preservatives. We're starting to get little bits and pieces of this information from some of the bigger studies. And that's a lot of, I don't know, microplastics maybe are in there too as a risk. And the fact that so many of our current foods, even if we are buying food that's not processed, the nutrient level has deteriorated because our soils and our agriculture methods and shipping and so on have put a price on the vitamins and minerals in our foods. So
Yeah,
the
and
other
what I tend to do is, I try and make it as easy as possible. Like I do cooking classes with my patients and stuff, and I'll teach
uh,
them how to do like recipes where it's like I love a good mason jar where it's like you've got 30 different plant ingredients in one jar. So now you're like, I don't need to worry about it the whole week. I've got these mason jars full of this. Or we'll do like a chia pudding that has like 10 ingredients in it. And it's not about the quantity of the food necessarily. It's getting that biodiversity. That biodiversity is what's going to set your microbiome up for repair. And I will say, in my older population, and when we do this testing, and I'm like, guys, you're starving yourself. Like you need to eat some real food. Like your cells are literally starving. And that's why you're feeling these symptoms. And that's why we're creating disease. It doesn't have the nutrients. And they're absolutely shocked when they see like testing and they're like, oh my god, I thought, like, I was fixing everything, and they have no idea.
yep, yep. Well, that's good advice. And the other things, the other organs that have kind of come into their prime or are coming into their prime that are doing more than we ever thought that they were doing are our bone and our muscle. So maybe sometime we can come back and talk about all the wonderful things that muscle does for us besides move us through space. So
Absolutely,
yeah.
absolutely, and interestingly enough, I did do another podcast episode on bone health and these specific ingredients, and it's pretty fascinating what they do to bone health. So, yeah,
Yeah.
absolutely. I think the key message here is how do we make our cells more resilient, right? And it's not about becoming invincible, right? It's about how do you have enough reserve capacity when stress hits or your symptoms, your systems, how do you respond to that and recover without losing days?
Yeah. An infection or an injury, as you just described, or a stressful life circumstance that you have to deal with that you can't just avoid, put family issues and so on. So resilience, yes, that's what we're seeking here. So this has been just wonderful, wonderful information and a fun interview. I really, really appreciate it. Thank you for joining us today. And to our audience, if this is the kind of information that you value, please like this and share it and tell your friends so we can have a bigger audience getting this important information. Thank you so much, Dr. Monisha.
Thank you, Pat, so much for having me.
Take care. If this episode spoke to you, please share it with a friend ready to take charge of her health. And please leave a review. It helps more people to find us.